All right, just like I said at the start of the show, that it's a bumper edition of the Bumper Breakfast Show, and we're serving you breakfast us this morning. We've gone to the presidential speech, we've been to the business world, and now we are now at the health sector. We have a very young doctor in the house. She's pretty, and she looks so young. Though looks can be deceiving sometimes, but she's young. I'm sure she's a young doctor. Her name is Dr. Lilian Ochayi. She is a resident public health physician at at Lagos University Teaching Hospital, which is LUT. Dr. Lilian Ochayi, welcome to the show.
Thank you very
Oh,
much.
I wish my daughter is watching this show right now. But she wants to be a doctor as well in it.
Wow.
Good morning to you.
Good morning.
Welcome to the Bumper Breakfast Show.
Good to be here.
Our viewers, that's what you should expect on this show every Tuesday. On this show, we now have a health segment where we have Lagos State representatives, Lagos State health representatives that will be coming here to talk about some health issues. Like today, again, we're looking at the importance of vaccination. I think they are now going all the way out to let us know our vaccination is important. Don't have this mentality in you that when you vaccinate these children, they are killing their brains. I can tell you some Nigerians have this mentality in them. When I had my first daughter, rather, the father's uncle said I wanted to take my daughter for vaccination. And do you know what he told me? He said that is what the whites are using to kill our children's brain. That is why we are not like them. That is why we can never have that kind of knowledge. They are kind of intelligence because of the vaccination we are giving to our children. But I never believed that. When he left, I had to sneak out to take my child, to my daughter for the vaccination, to be vaccinated. And right now we are looking at the importance of vaccination, protecting our future against measles, HPV, and yellow fever. All right, doctor, welcome to the show.
Thank you so much for having me. Yeah, so we're here basically just to speak on why immunization is important. So we see, like you said, there are a lot of people that actually don't, have a lot of misconceptions about it. But the main thing to note here is that it is one of the global health success stories because it prevents millions of deaths every year. Okay, there are over 20 life-threatening diseases that are vaccine preventable right now, and being vaccinated alone reduces your risk of being infected or getting these diseases. And another reason why it's important is that it doesn't only protect you or prevents you from getting these diseases, but also protects your family and also the community, because some of these diseases are contagious, right? It can be spread from a person to another, and to prevent this, it's important that a person is vaccinated, because if you are protected, the person living next to you, your husband, your wife, your children, they are also protected, and also the community at large also is protected. So we're speaking basically to yellow fever, measles, and HPV, because we have this integrated immunization campaign coming up from the 19th of October to the 2nd of November. So why we're focusing on this, yellow fever is also a vaccine preventable disease that is life-threatening, and it is transmissible through mosquito bites. So not the mosquitoes that cause malaria, a different species of mosquitoes, but when an infected mosquito bites a person that has not been vaccinated, they stand a chance of being infected with yellow fever. And we've been having outbreaks, in Nigeria, and we've been recording cases of them over, since 2017. And so to prevent, it from escalating and getting to a point where, and again, Lagos is particularly vulnerable because we have, it's densely populated, and then we have people moving in and out all the time. So that also makes it, makes Lagos quite vulnerable. So it's important that we get people vaccinated against yellow fever. And for measles, it's also vaccine preventable, but highly contagious, and it's a childhood killer disease. And children are usually expected to get that at 9 months, but we see that nowadays with new births, people are missing their vaccination schedules, and they don't end up getting measles. And presently we don't have an outbreak of measles, but because number of people missing these appointments are increasing. So to prevent this is why we are also putting measles in this campaign. Then to the last one, which is HPV, that's the human papilloma virus. It is basically it's responsible for cervical cancer, and cervical cancer, we know that it occurs in women because only women have cervixes, men don't have cervix. So that's why the target for this is females, and it's mostly sexually transmitted. So to prevent this is why the target age group for the vaccine is 9 to 14 years. So that's basically HPV is,
So just 9 to 14 can be vaccinated. What about people above 40?
I wanted to ask
40,
the question, yes.
Like
yes,
45.
Right.
Can we still be vaccinated?
Thank you very much for that. So, yes, but the focus here is because it is sexually transmitted, and we're looking to prevent them from getting exposed to this HPV. So the aim is to give this vaccine before they become sexually active. So it's more effective when done, before they are sexually active, and that's why we are saying 9 to 14. For people above that have been sexually active, they have to run a test, before. They can't just get it.
Okay, I wanted to find out more because it's interesting knowing all of this. These are just basically for children.
Yes.
Because I know that some vaccine, so no, go ahead, you wanted to say something.
The yellow fever, so the age range for that is from 9 months to 44 years. So adults are also going to be included in the yellow fever.
So do we have vaccinations for adults? Are they vaccines for adults that one can take to prevent illness?
Like, can adults be vaccinated?
Yeah, that's what I'm saying.
But I know there should be a test.
Like we had COVID-19.
That's the only one I had. Before COVID-19 came, I didn't know that one can be vaccinated. That's what I'm saying. Do adults have, especially,
For the
age group?
Yes, they do have for the HPV. Okay, they do have. But for this campaign in particular, the focus is on...
So the sensitization is for these children right now.
14.
Because I know that
9 to 14.
we have this background where some people feel, why should I get my child vaccinated when I can take Agbo, the local herbs? Now, some people tell you, why should I go there? So I wanted you to just look to the camera and let us know why we should, why it's very important instead of the herbs we take, why we should visit the hospital for vaccines.
Okay, so thank you very much for that. So why vaccines are very important is because when vaccines are introduced into our body, they help, our immune system, our defense system to build immunity specifically against, this particular diseases that we're trying to prevent. The agbo you take, they are not specific towards the diseases, right? Because when these vaccines are introduced, it's usually a killed or a weakened virus or a weakened agent that is being given to this person to trigger their immune response, so that when they are exposed to this infectious agent later again in the future, their body recognizes that, have built immunity towards this, and their body is able to respond better. So this is why vaccines are, specifically of more of an advantage compared to the local herbs, and things like that. And when you're giving immunity towards a particular disease, when exposed to that later, your chances of being infected are significantly reduced.
All right, doctor. When will this campaign commence?
Right. So the campaign is commencing on the 19th of October
So when?
till the 2nd of November.
2nd of November.
Yes. So
The vaccination, are they free?
yes, they are completely free.
Okay.
They are free, and people can have access to them at primary healthcare centers, general hospitals.
All primary healthcare centers in Lagos.
Yes.
Okay.
Yes. Primary healthcare centers in Lagos, general hospitals, teaching hospitals, and then we're also going to be going to some workplaces, religious organizations, churches, mosques.
To vaccinate the children, just the children alone, 9 to 14.
Yes. So the age range for measles. It will be from 9 months to 59 months.
Okay.
For yellow fever, 9 months to 44 years. So adults are involved, are included in that for yellow fever. And HPV is 9 years to 14 years.
Okay, I think you should actually speak on misconception,
Alright.
especially when it comes to HPV, because I know that kids will actually need the consent of their parents, and now most of them, just like Tessie said, most of them already have some misconception about it. So I really need you to speak on that and probably reassure mothers that HPV vaccine is actually safe for their kids to take.
Okay. Thank you very much for that. Because yes, we have actually gotten so many things. Different people have said things, but HPV vaccine is very important because we're preventing, this is cancer, cervical cancer, and it is serious. I mean, almost a lot of people have heard about cancer, and we know that when someone gets cancer and it gets to the point where it starts to spread, it's very difficult, and it's also financially draining to start to think of all those things. So if it's possible to prevent it, why not? And this is a way to help protect our girls, because why we are focusing on girls is because, like I said, cervical cancer only happens in females. So we're not giving males now because they're not the focus, presently, because they cannot get cervical cancer. And while we're trying to give this vaccine now before they become sexually active, to increase their chances of being protected against cervical cancer, because it's something that is basically the second leading cause of death among women right now. So to prevent this and to also protect our females, we're just saying that parents should bring their children to be vaccinated, because we want to invest in their health, and I want them to grow up to fulfill their dreams, and yes, so that is basically what we're trying to.
Thank you very much, my doctor. We appreciate you.
Thank you.
And I know the viewers at home have been able to. We've been able to enlighten and educate them about HPV, yellow fever, and there is
Measles.
There is there's measles as well. That's not even what I was about saying. I wanted to say the campaign starts when?
On the 19th of October.
So 2nd of November,
Yes.
2024.
Yes.
And in case they do not come to your doorstep, you'll be going to doorstep by doorstep, right? Is that what you're doing?
Just the workplaces, where people are going to be like, where people are going to be gathered. So workplaces, churches, mosques, schools, and then people can also go to primary health centers.
Okay,
There is
so
time frame to
they are
it.
not coming to
That's
your
what she
doorstep.
said.
So in case they do not,
That's what she said. She said,
Okay.
is there a time frame to it? That's what
Yes.
she said on the 18th, on
No,
19th.
like time, like let's say today now, is it from 8 to what time? Or
Is it all day?
All through the day?
Yeah, so
the health center closes at by 4 p.m., right?
Yes. So up till that time, then you can.
So now, something good is coming to Lagos State for those who go to private hospital to pay for vaccination. For me, I believe vaccination is prevention. I think that is just another easy word for vaccination. And just like they say that prevention is better than cure. So something good is coming from this month, October 19th to November 2nd. You go to your health center, get your baby vaccinated. And for those who have daughters that are not yet sexually active, that is from 9 to 14, go get the HPV vaccine. We all know cervical cancer can be killing. We all know it kills And so people surviving, that is when it is discovered on time. So health, they say, is wealth. Health is wealth. Take care of yourself. It's still the Bumper Breakfast Show. Stanley Polika will join us for Bumper Spot Update. But from all of us here, this is how we end the Bumper Breakfast Show this morning. We'll see you on the Bumper Breakfast Show on Wednesday, Thursday, Friday, Saturday, Sunday, relax.
Then Monday we start up again.
We want to enjoy our life. Then Monday we're back again to start talking about the problems of Nigeria. My name is Teresa Adeyemi. Happy Independence Day.
And I'm Vera Osopo. Please keep praying for Nigeria. Happy Independence Day.
And I am Vina Peters. Happy Independence Day, Nigeria.
From all of us,